So Dr. Nahla, if you'd like to speak over these wonderful visuals, what are we looking at?
So in this short video, we are looking at the lymphatic system, where we can see the lymph nodes and the venous system, which is the venous system and arterial system, which is part of the circulatory system in our body. So when the patient have a cancer and this has been dealt with surgically and there is a lymph node excision, this is what happens in 40% of the patients who are surviving the breast cancer, swelling of the arm, and this is what is called lymphedema.
Fantastic. So we're diving straight into the actual specialist subject that we're going to talk about now, understanding lymphedema, and this is the innovations in breast cancer treatment. So lymphedema, you guys are giving me challenging words. This is a challenging subject. Dr. Stephen, building on what Dr. Nahla has kindly introduced us to, these very curious looking visuals, lymphedema, let's bring everyone up to speed. What exactly is it, and how prevalent an issue is this? Is your mic working? Let's try that one or this one. Give this second one a go.
So thank you for the question, and thank you for the organizers. This is such an important topic that we're, as a multidisciplinary team, are making a lot of progress in. As was mentioned, a common cause of lymphedema is the treatment of breast cancer. And we've learned over the years that surgery for breast cancer, which involves removal of the lymph nodes under the arm, along with other treatments that we give for breast cancer, can lead to a condition called lymphedema. And that manifests itself usually starting between a year, 2 years, 3 years, or longer after the treatment's over. The patient will develop some form of arm swelling. And that arm swelling can be very mild or in some cases very severe. And the problem is that the patient who went through breast cancer treatment may have their cancer cured, but they lived the rest of their life with the very, very debilitating symptoms of arm swelling. So every day they wake up, they have a heavy arm, their arm hurts, they can't wear clothes properly. And so we spent a lot of time, I'm sure we'll talk more about it in this session, of working as a multidisciplinary team to reduce the sequelae called lymphedema, while at the same time we've learned to give other treatments and do other things that can reduce the rate with which this happens. So overall, providing safer and better care for patients.
And when it comes to this issue, how many breast cancer patients are affected? Is every patient affected? How prevalent an issue is this?
So as she mentioned, it's been reported to occur in up to 40% of patients, mostly in those patients who have all of the lymph nodes removed under their arm as part of treatment. But it can even happen when we just remove a few lymph nodes. So again, this has been the impetus for so many people working so hard, and we brought a lot of the technology and know-how right here to Abu Dhabi to help now prevent this problem. And for those who have developed it in past years, we have now a system in place to help manage those symptoms more effectively.
And we really want to hear more about those solutions. So that's a really good way for us to set up the gravity of this issue and the scale of this issue as well. And as you say, Dr. Stephen, these are long-term implications. The cancer treatment can end, but patients can live with this. So this is a huge, huge issue. Dr. Nahla, if I can bring you in, Dr. Stephen Grobmyer mentioned there the multidisciplinary approach when it comes to care models. How can they enhance the patient's experience?
Yes, this is a very good question. So Amal, imagine someone with breast cancer. She's survived the treatment, but then now she has to face the challenge of daily discomfort of the swollen hand that cause also immobility. So we have established the multidisciplinary clinic at Health Point that target every aspect of these challenges. So it starts with early diagnosis, because early diagnosis with the lymphedema patients, this will help to improve and give a better quality of treatment as well. So it's not only the early detection, but also the MDT, as we can see in the picture here. So when we have the patient visiting our clinic, she will be assessed by multi-team consisted of physiotherapy, where some patient needs deep congestive therapy. She will be seen by psychotherapy. She will be seen by the radiologist. She will be seen also by the plastic surgeon. And depends on these things, we have the educational nurse that can teach the patient as well about what is the lymphedema, how to treat it, because sometimes this is a chronic condition that the patient has to live with these challenges. Every MDT member of this clinic has a role and has a task. The task is how to help this patient, how to improve their quality of life. And I think MDT is a key, and it has the magic in treating and helping the patient to overcome these challenges with the lymphedema. Sometimes with the surgical intervention or non-surgical intervention, we can help to cure or reduce the symptoms, but in some cases, this is a condition that is chronic and needs lifelong treatment.
So you mentioned there about treatments that can help alleviate some of these symptoms to put the patients at ease.
Yes.
When we speak about prevention, where can that play a role in this? How can we prevent even lymphedema occurring?
The good news is there's been so much progress in the treatment of breast cancer in the last 20 years. And a lot of the progress we've made has been focused on trying to reduce the amount of axillary surgery, the lymph nodes under the arm. So the research has now shown that many patients don't require full lymph node removal, and that in many cases, even if there's lymph node involvement, the lymph node involvement can be treated with a different modality. Again, multidisciplinary team. We treat the patient with radiation therapy instead of surgery, and in many cases, that radiation therapy is very effective at treating the cancer, but leads to a lot less lower rate of lymphedema. And this was all made possible through lots of research done around the world. The other thing we're doing is we have significant improvements in the medical treatment of breast cancer. And now we've learned that if a patient presents with breast cancer and they have involvement of the lymph nodes under the arm, we can start the patient on chemotherapy, certain types of very targeted chemotherapy. And with the medicine, we can actually clear the disease in the lymph nodes. And now we know those patients don't need lymph node surgery. So the way we're preventing this problem is by improving the other treatments that don't have the same side effects as surgery. So that's one of the big advances that's been made in breast cancer treatment in the last 20 years.
I think that's super fascinating, and it's so cutting edge. And I have to credit both Dr. Nahla and Dr. Stephen. You explain it in such a wonderfully articulate fashion. You almost make it sound very straightforward, but the research, the experimentation, the expertise it's taken behind all of this to get to this stage. I mean, goodness me, it's decades, it's so much hard work for so many teams around the world. So it's wonderful that you encapsulate this for us in a very neat answer. But this is complex, and it's been a complex journey to get to this point.
Yes.
Dr. Nahla.
Yes, I agree with Dr. Grobmyer, and I think prevention is a key. And I look at prevention before having the breast cancer through the screening program that we have, because we have a prevention before the cancer happens, and then we have another task, which is the prevention if the patient has been diagnosed with the breast cancer. And I refer this to our team and colleague in the oncology to identify patients who are at high risk of developing lymphedema, because not every patient who have breast cancer, it means they might have lymphedema, but there are a group of patients who are at high risk. So in these patients, we can identify them, and then we can also discuss with them the option of having some surgical intervention during the mastectomy or during the cancer removal. So let's say a patient who had cancer and she needs surgery to remove the cancer tissue. Sometimes we can identify the lymphatic tiny vessels and then we connect them. So this is considered as a prophylactic LVA, a prophylactic lymphovenous anastomosis, as a prevention measures. before the patient have the lymphedema and this group of patients.
And that's really interesting. And Dr. Nahla, I'm going to ask you to explain some of the visuals that we're seeing behind us. Do they speak to what you just mentioned there?
Yes, exactly. So in this visual, we are seeing the cutting-edge technology of what we are doing, lymphovenous anastomosis, either as a prophylactic or as a treatment. So in this video that we saw, we identify the tiny little lymphatics, and we connect them to the nearby vein. So in this technique, we bypass the damage that happened. And with this technology, we use something called ICG. The ICG is imaging tool that maps and draw for us where are the lymphatics and where is the point of obstruction. So this guides us in the surgical intervention in the operating room.
And let's delve in deeper into the innovations and the technological advances in just a moment. I'm just going to open it up to the audience. If the audience has questions, please do indicate with a hand gesture. I know that we have our esteemed experts of health professionals with us, so you may have some questions, and our international guests as well that are joining us, so don't be shy.
I'll just make a comment. This all sounds very simple, and we have a very humble team around us, but the technique of lymphaticovenous bypass in the United States, where I used to work, Cleveland Clinic was one of the first sites in the US to really develop this. And this is not a procedure that's done widely. We brought a team, once the cancer center opened, we brought a team, an entire team around us that now are able to do these very, very, very technical operations that are not done everywhere. In fact, it's not done most places. So it speaks to the emphasis on complex care and what we're able to do by bringing these, bringing together world experts to work right in our hospital in Abu Dhabi. But it sounds real simple. You just sew this to this, but the technical part of this took years to develop. The blood vessels and the lymphatic vessels that are being sewn together measure about 2 millimeters.
Or less.
2 millimeters.
That's incredible.
So this has to be done under a microscope, and not just a microscope, a high-powered microscope. So again, this is something that we should be really proud of, that our team is able to offer to patients that is not widely available.
Absolutely, and you're right to make that very valid and astute point that what's being developed here and provided to patients here in the UAE is really not only world-class, but it's actually a rarity, as you say, globally speaking. Dr. Nahla, what is it about the ecosystem here in the UAE that allows this type of advancement and allows it to be accessible to patients?
Well, our clinic is open for everyone, every patient, Emirati, non-Emirati. We are not looking after only breast cancer-related lymphedema. We are also looking after patients who develop lower extremity due to gynecological lymphedema or urological. And sometimes we see primary lymphedema who are born with defects in the lymphatic system. So all these measures we've been taken in consideration for everyone, so we are accessible. Just talking about this, yesterday we received even a patient from Saudi Arabia. He drove 6 hours only to come to our clinic at Health Point because he wants his condition to be treated. This patient have Ewing sarcoma, and then he's been treated, but then subsequently he developed the lymphedema. So we are open for everyone, accessible to everyone. We are trying to give the best of the best to our patient. Even like what my colleague have mentioned, this is a very delicate procedures. The diagnosis is not easy, but we are trying to make it simple. But it takes a lot of hard work, a lot of research, a lot of dedication, I have to say, and a lot of patience.
And in terms of speaking on what Dr. Nahla has outlined there, still a lot of hurdles, many challenges ahead, it sounds like. Challenges have been overcome and you've reached this stage. Looking ahead, if I may ask you both to cast your vision forward, how can the innovations which are being developed now really help shape the future of lymphedema treatment?
Great question, and I think everything that we've heard on this stage in the last several days speak to the importance of precision medicine. because as we better understand the genetic makeup of patients and the cancers that they develop, we will undoubtedly be leaders in developing the next generation of treatments, which will be more effective than ever. And in a perfect world in the future, no patient would need surgery for breast cancer. We would, first of all, be able to prevent it, and in those who do develop it, we'd have elegant treatments that have limited side effects, require no surgery, and the world will be a better place. So it speaks to the importance of all the hard work that the teams here are doing to bring to life the next preventive strategies and treatments.
And how far off are we from that vision? Are we speaking decades? Are we speaking?
It's happening now. So we now have clinical trials that are ongoing around the world that are showing there are certain types of breast cancer and certain situations where safely no lymph node surgery is required anymore. And this is an effect of improvements in medication and improvements in selection of patients and how they're treated. And it's a commitment to what we call de-escalating therapy, safely reducing treatments that have historically been done that are not needed, and allows patients to still have a very good outcome.
That sounds fascinating that is happening right now. Dr. Nahla, your perspective on this, how innovation is shaping the future lymphedema treatment, but also prevention.
Yes, actually I believe in prevention, and as we mentioned earlier, prevention is a key. So identifying patients who are at high risk, talking to these patients and educating the patient about what are the options available in case they had these kind of surgeries. And also we're talking about innovation as a new digital health innovation, like small tools that the patient can take with them at home to measure the volume of the lymph, the circumference, if there is any changes. This will detect the disease in early stage, and also using something like the ICG in the clinic to identify the patient if they develop any obstruction of or delay in the lymphatic flow of the arm. And I believe also recently we are seeing the super microsurgery robotics, which will give us more precision during the surgery, reduce the time, and of course will improve the outcomes of the surgery. This all will reflect on the patient outcomes, prevention measures, and improving the quality of life for the patients.
And I think that's really an astute point you make about robotic surgery. Dr. Stephen Grobmyer mentioned earlier, 2 millimeters. I mean, we're talking, I mean, that's exactly where this type of technology would be very handy. We've spoken about the 3 Ps here already: prevention, precision, and predictions, early diagnosis. I'm going to bring in the 4th one, partnerships. Now, of course, you being on stage with us here today really represent this. How important is that? Partnerships and collaboration to get to this point and actually shape the future of treatment?
It's absolutely critical. Science and technology these days don't develop in isolated
silos.
Environments. It's a team sport now, and you need to have excellence in all aspects of the team, and we're fortunate to have that. And it's that excellence and people incentivized to work together for a common goal that it's going to radically change the future.
Dr. Nahla?
Yes, I believe collaboration is very important in the field of lymphedema because it's new. All these technology that we are talking about, it's new. Sharing knowledge and sharing information and researches around the globe about this and what is the advances in the treatment is very important. The new surgical techniques that evolving with the time, with the evolution of the AI as well, it's very important. So sharing knowledge is important, including the genetic testing and a genome into this. This is very important as well because recently we have developed the gene panel for lymphedema for patients who have breast cancer, lymphedema, or other kind of cancer treatment. And we have recently found something called BioBridge, which is a scaffold of lymphatic channels that can be inserted under the skin or implemented in the lymph nodes. So all these are a new innovation, and without collaboration, the knowledge that will be shared is minimal. So collaboration is very important within the entity of itself, within the country or outside. I believe it's very important.
Really strong point. And on the note of collaboration, I want to collaborate with the audience and open it up. I believe we have a question. May we please get a mic to our audience member here? Many of you will be familiar with Dr. Fatima Radin, Senior VP of Clinical Development at M42.
Thank you so much,
Dr. Fatima. Ask your question.
I have a question for you, Dr. Nahla. First, how challenging is, in fact, to build this team of lymphedema? It's a microsurgery. How challenging to have all this equipment, but also from yourself and your team, how challenging to have the right education and the right training? And then for Dr. Stephen, cultural sensitivity is an important, in fact, compound to be considered if we want patients who are compliant with the treatment. Are you happy to have Dr. Nahla on board as a female Emirati lymphedema expert?
Excellent questions.
Thank you so much. Well, the challenges are there, but the good thing is we are surrounded by a very supportive system that makes these challenges an ease. The first thing is the learning curve from a surgeon perspective. So doing microsurgery is not straightforward. It needs a lot of learning, a lot of dedication, lots of patience. The second thing is building the team that understand what is lymphedema and put the patient as first. What is our goal? How we can achieve this? The clinic itself to have physiotherapy that is qualified in lymphedema therapy is very important. And in our region, there are few, not many. From the radiological perspective, imaging technique, this is very important because in the past, we always rely on something called lymphoscintigraphy. But now we have ICG technology, and more recent, we have MRI lymphography. And I'm very proud to say Health Point have the first and the only MRI lymphography in the region. So this needs dedication and also a learning curve from our side. So we talk about plastic, physiotherapy, radiology, and then the psychology. The psychology, we always put it on the side, but it's very important because some patients, when they come, they think surgery will cure them. And this is just an acute phase, but it's difficult to tell them, no, the surgery will improve, but there are challenges that you need to overcome from your side. And then the wound care and then dietitian, having daily living healthy habits, this is very important. All these challenges, without the collaboration, without being one team, it's difficult to face.
And I think you're absolutely right, Dr. Nahla. You make a very profound point there about the holistic approach and the realism that needs to be required when it comes to the psychological approach there. Some really strong points. Thank you for sharing them, Dr. Nahla. You've been a wonderful asset here on the M42 team. On the stage, such a wonderful speaker. And as Dr. Fatima kindly asked Dr. Stephen Grobmyer about having a very strong, talented Emirati professional with our esteemed Sheikha as part of our audience here today, after that opening panel discussion with our esteemed colleagues, Dr. Stephen Grobmyer, we are wonderfully honored to have such talent here in this country. And the international collaboration that the UAE really does open up itself to.
There's no question that one of our great strengths here is diversity. And we're lucky to have physicians who have trained in different parts of the world that we share knowledge with, and it allows us to create new and better approaches. That's really the path forward. So we're privileged to work in such an environment.
Absolutely. And on that note, I know that we have run out of time. Please, if you have any questions for our audience, they are super approachable. Our audience, if you have questions for our panelists, please do approach them afterwards. I'm going to say a big thank you to Dr. Nahla, Dr. Stephen, for taking time out of your very busy schedules to come and share not only your own personal experience, really set the scene for us about how this is revolutionary and paint the vision for the future as well. We've been talking about innovation, but keeping it people-centric. As you said, the psychology is really important, as well as the innovation. My wonderful audience, please give my wonderful panelists a big round of applause. Thank you.
Thank you so much. And I would like to share a small video,
a small
testimony from one of our
yes,
patients.
You're absolutely right.
So,
I did forget about the video,
exactly.
but yes, let's...
This is an amazing patient who had a lymphedema-related breast cancer, and she was treated at Health Point.
Fantastic. Let's watch it now.
مرحبا معكم الدكتورة نهلة
There is a
المنصوري
translation.
استشاري جراحة التجميل والترميم في مستشفى هيلث بوينت. اليوم رح نتكلم عن عمليات ترميم الثدي لأي شخص كان مصاب بسرطان الثدي وتم استئصال الورم سواء كان استئصال جزئي أم استئصال كامل. عمليات ترميم الثدي هي ليست إجراء جراحي فقط لترميم المنطقة المصابة، وإنما أيضاً لها دور إيجابي مهم في ترميم الحالة النفسية للمصاب، لأن السرطان لا يدمر الأنسجة فقط وإنما أيضاً يدمر الحالة النفسية للمصاب. مريضتنا اليوم كانت تعاني من سرطان الثدي في الماضي، لكن الحالة فيها نوع من التحدي. ليش هذا التحدي؟ خلنا نشوف مع بعض. منطقة الثدي عندها فيها تضخم للثدي، الحلمة والهالة موجودين في الأسفل، لكن السرطان كان موجود في منطقة الإبط بهذا الاتجاه. ففي الماضي تم استئصال الورم وتم أيضاً العلاج الإشعاعي، لكن اللي حدث مع مريضتنا أنها صارت تعاني من احتباس السائل الليمفاوي في جميع مناطق الثدي، وأيضاً توجد كبسولة تحتوي على السائل الليمفاوي. فالتحدي اللي كان موجود إن احنا كيف نقدر نصغر الثدي، نتخلص من هذه الكبسولة، والأهم نحافظ على تروية الدم والإحساس في منطقة الثدي.
So 2 years ago, I was diagnosed with the breast cancer, which was devastating news. I had a busy job in Dubai airport. I was treated. I had my surgery done a year ago. It still gives a lot of lack of confidence being a woman and seeing the changes on the body, which actually was accepted in a way, however, doesn't help much psychologically. One of the most caring hospital actually. You are between the people who enjoy their work, and that gives a lot of peace. Being a patient here. You are here, you are with us, stay comfortable, relax, don't be stressed. We will take care about everything. That's my experience with the Health Point. Life become more colorful, more color. That's what I would like to say.
That's a very powerful
لأن هذا النوع من
testimony.
العمليات فيها الكثير من التحديات والتعقيدات، لذلك مهم جداً اختيار طبيب ذو خبرة والمكان المناسب. هنا في هيلث بوينت لدينا جميع التقنيات الحديثة والمتطورة لضمان الحصول على أفضل النتائج. دائماً معكم، نتمنى لكم دوام الصحة والعافية.
That's fantastic. Dr. Nahla, I'm really glad that you shared that. A very powerful patient testimonial. And may I say that you and I can be co-hosts for the next event. Dr. Nahla does a great job of presenting there. Both of you do. You make this information super accessible. And you're right to say, Dr. Stephen, we don't want to simplify the complexity behind what we're discussing here, the decades of expertise that goes to coming to this point. But what's really powerful about these platforms is that we make this information accessible. Not simplified, but accessible. That's our mission. On that note, may I make you accessible to the center of the stage as we take a photograph. And if I can ask the team to please position us correctly. Thank you. And another big round of applause to my guests. Thank you.